Hello, this is Rashi Sahai, and you're watching Medicircle. Today, on our cancer awareness series, we have Dr. Gopal Pemmaraju with us. Dr. Gopal Pemmaraju is a consultant radiation and clinical oncologist at Nanavati Max Super Speciality Hospital, Mumbai. For the past 8 years, he has been working in this field. Welcome to Medicircle, Dr. Gopal Pemmaraju.
Thank you very much.
So, as head and neck cancers are rising in our country, worldwide, head and neck cancer is the seventh most common cancer, and overall, the fifth most common cancer in men and 12th most common cancer in women. HNCs are very common in India, constituting 30% of the cancers in males. Head and neck cancer is most common than female. So, doctor, can you please tell us that what is head and neck cancer?
Head and neck cancers, as such, is a broad term. It may be, we can divide it into two different parts depending on the anatomical sites of where this head and neck cancers malignancies affect. Depending on the anatomical sites, we have the cancers of the nasopharynx, cancers of different sinonasal cavities like this, like that of ethmoid sinus, sphenoid sinus, maxillary sinuses, and there are cancers of the lip, buccal mucosa, tongue. We have cancers of oropharynx, supraglottis, and also larynx, and also hypopharynx. If you come to other part, there are many types of histopathological features, like that of squamous cell carcinomas, adenocarcinomas, and mucoepidermoid carcinomas, and different types like that. Depending on that, different types of cancers and on the different anatomical sites which the malignancy affects, there are different treatment options further. And what are the treatment options which we have? Basically, are surgery, radiation, and chemotherapy and targeted therapy. Depending on the site on the and also the histopathological variant, the treatment varies.
So, what are the warning signs of head and neck cancer?
Coming to warning signs, non-healing ulcers. Many people experience non-healing ulcers on the over the tongue or over the buccal mucosa, over the lip, or sometimes in the throat. Some irritation they feel, and sometimes the patient may experience swellings. Maybe there may be swelling in the oral cavity, or maybe swelling in the neck, maybe lymph node enlargement, maybe because of the lymph node enlargement or because of the tumor infiltrating the main important structures inside. They may come out as a swelling, and some may experience some. If you see the cases like supraglottic cancers or the cancers of the larynx or of the nasal cavity, patient may experience change of voice because of the infiltration of the tumor. And some may experience difficulty in breathing because if you see the windpipe, if you see the larynx or supraglottis, where we normally breathe during inspiration and expiration, if there is growth inside, the patient may experience noisy breathing. Sometimes patient may experience difficulty in taking breath also while sleeping or lying supine. Some may also experience difficulty or pain while swallowing. If there are tumors in the posterior pharyngeal wall or some tumors in the hypopharynx, like piriform fossa or near post-cricoid region, patient may experience difficulty in swallowing, and also sometimes while taking some spicy or oily foods, patient may experience irritation. It may come up as a cough, or some may also have pain and unexplained weight loss. Because if you see cancers, whatever the nutrition patient takes, whatever the food he takes, most of the carbohydrates like glucose and most of the important nutrients will be taken up by the cancer cells. Because of that, patient may experience unexplained weight loss. Some may experience bleeding also because cancer cells and cancer, whatever the growths are there, they are highly vascular. If there are any small vessels, if there is slight rupture of the blood vessels or anything like that, it may come up as a bleeding. Most of the times, these are the main warning signs.
So, doctor, what causes head and neck cancer?
As such, head and neck cancers, the most important cause is chronic irritation. It may be due to uh, exposure to chronic exposure to carcinogens like tobacco, it may be in chewable form or smoking, or sometimes exposure to toxic fumes. Some industrial workers, they are persistently exposed to these toxic fumes. And also some people may have sharp tooth. Chronic irritation over the buccal mucosa may also leads to these cancers. And one more thing, human papillomavirus infections. It is not common in India, but in Western people, it's very common. And these days we have vaccines also for this HPV virus. Most of the times, HPV virus normally causes cancers of the oropharynx. Okay, most of the time, these are the things which cause cancer of the head and
So,
neck.
can head and neck cancer be detected at an early stage?
As we already discussed, we have many warning signs because most of the people neglect these warning signs because if you have an ulcer on the oral cavity, most of the people think that it's normal. It may be due to vitamin deficiency or something, or because of having spicy foods. Because if it is not healing for a long time, or there is swelling over the neck, or there is some ulceroproliferative growth inside the oral cavity, or there is sometimes patient may experience cough, persistent cough, unexplained cough. And if a patient experiences weight loss more than 10% in the last 2 3 months, if they can immediately consult a doctor nearby, or if they have accessibility to oncologists, we can have an early detection of the cancer. And as all know, early detection leads to good prognosis. And patient may suppose if we have a cancer of the buccal mucosa, and if we see if it is detected early in the very early stage, if the lesion is less than 2 centimeters or something like that, just getting on with surgery is enough. Sometimes patient may neglect, and if it goes to higher stages, it may go to lymph nodes, or surrounding structures may be infiltrated. That surgeries will also be uh, it's not normal surgeries, extensive surgeries they will require, and some may require some tracheostomies, and some may require total laryngectomies. Instead of going further, if we can detect that in early stage, and if we go for proper management at a best earlier point, prognosis will be much better, and treatment options will also be much. We have very much many treatment options further.
So, doctor, how fast do head and neck cancers grow?
It depends on, there are many risk factors further. One most important thing is, as we already discussed, histopathological variant. Some histopathological variants are very aggressive. Suppose if you see the cancers of the squamous cell carcinomas, they're very aggressive. Sometimes that much aggressiveness is like within 10 15 days, or during treatment they may progress. And some may go to some distant sites like the lung, they may infiltrate the nodes. And if you see these areas, cancers of the skull base or anything like that, they may infiltrate the important structures also. It depends on the histopathological variant, first important thing. Next, second part is nutritional and immune status of the patient. Because if patient is immunologically, or if you say uh, if there is unexplained weight loss, and he's already poor in this whatever what we say deficiency in many essential vitamins and amino acids and proteins, that aggressiveness may vary. And some, because as you know, chronic irritation leads to mutations of the DNA. If depending on the number of mutations and the varying degree of this genetic changes, aggressiveness may vary.
So, like, how can people who have had head and neck cancer reduce their risk of having the same cancer the second time?
As you know, around 30 to 40% patients of head and neck cancer, even after complete treatment, even after surgery, after radiation, chemoradiation, and even after targeted therapy and everything, around 30 to 40% do have second recurrences. As such, there is no rule of thumb to minimize this. Only thing we can do is minimizing the exposure to toxins, because as we already discussed, the exposure to tobacco or toxic fumes or sharp tooth, or some people have the habit of chewing this gutka and all. If they can be minimized, then the risk of recurrences can be minimized. And maintaining proper nutritional diet I'm specifying. It should include all the essential vitamins, all the essential amino acids, and healthy proper diet. It's most important thing. And one more thing is exercise. If a patient can take care of this, recurrences can be minimized. At least up to 50 to 60% they can be minimized, because we can't change the mutations which have already occurred. But with the taking proper care and maintaining healthy lifestyle, all these can be minimized.
Okay, doctor. So on Medicircle, our main focus have always been to provide the audience with large amount of information in less time. And so today we will be conducting a small question answer round in which you can answer in 1 or 2 line sentences. So doctor, my first question is that how many head and neck cancer patients receive the radiation therapy?
Around 70% of the patients need radiation at one point or the other. It may be definitive radiation treatment, or after surgery, what we call is adjuvant treatment, sometimes like neoadjuvant, because if tumor is very huge, we can't resect surgically. We may give radiation prior to surgery. We can reduce the size of the tumor, and after that we can go for surgery. And sometimes in palliative setup, like palliative setup means if there is, because if there is tumor in the larynx or supraglottic lesion, if there is obstruction, patient can't even swallow the food, or if there is profuse bleeding from the tumor, radiation helps. It reduces the bleeding, and whatever the obstructive symptoms are there, they can be minimized.
So where do we generally stand in the fight against head and neck cancer?
With the advent of many advances in the field of radiation oncology, or if you say chemotherapeutic agents and robotic surgeries have come up, and many targeted therapies where we can directly target the mutation or enzymes which are the cause for this cancer. Around 70 to 80% of the head and neck tumors can be treated, managed, kept under control with minimal side effects.
Okay, doctor. So are there any side effects of radiation therapy for head and neck cancer?
Radiation as such has many side effects, because along with the whatever the tumor we are targeting, some dose radiation dose also goes to the normal structures. Because of that, if you see head and neck cancers, uh, we patient may experience mucositis, a small ulcer like thing during treatment, or there may be slight difficulty in swallowing, or irritation or pain while swallowing. Rest them, because we have many advanced techniques now. No, radiation effects can be minimized, and there are some acute and late side effects. But all these are temporary. Once we finish with radiation, within 2 or 3 months, all will come to a halt, and patient will lead a normal life with better quality of life.
Okay, doctor. Thank you so much for coming to our show and sharing your valuable time and insights with us at Medicircle. It has been a pleasure
Okay,
having you on the show.
okay. Thank you so much.